Hello guys, this is Dr. Possibility from Excel Academy. Kindly make sure that you subscribe to our YouTube channel and make sure that you register with Excel Academy. In this tutorial, I'm just going to explain my part 5 of Anatomy MCQ revision. So please make sure that you subscribe and make sure that you watch my part 1 to part 4. Let's quickly look at some few examples. So the first question is, baby of Sarah Mwanza was born after doing maneuvers for shoulder dystocia, a condition where the baby's head is out but the shoulders are stuck in the pelvis during spontaneous vaginal delivery. The diagnosis came after a failed attempt to deliver the baby's head by pulling it, but it was noted that its anterior shoulder is stuck behind the pubic symphysis. This baby is likely to suffer which of the following injury? So if you look at the injury which has been explained, one of the important content which has been stated is whereby the anterior side of the shoulder has been affected. So during delivery, there are so many types of injuries that can take place as you deliver the baby from the mother. And then one of the injuries is whereby the brachial plexus is being injured. So like you have noted here, there is a statement where we have been told that there is an injury in the anterior shoulder. So in that case, we need to understand that in this case, there is an injury on the brachial plexus. So one of the nerves, which is a nerve injury in this case, so one of the nerve in the brachial plexus has been injured. So in this case, the baby, according to what has been described, the condition is just the Erb's paralysis. So the Erb's paralysis is one of the common birth injuries that take place when delivering the child. Which nerve roots are involved in the likely condition for baby of Sarah Mwanza in question 2? So the baby for Sarah in this question is likely to have been injured by an injury which has affected C5 and C6 roots of the brachial plexus. Regarding the relation of the first limb, the following is true. A. Subclavian artery passes posterior to the scalene tubercle. B. Middle tract of the brachial plexus passes posterior to the scalene tubercle. C. Scalenus medius attaches on the scalene tubercle. D. Sympathetic chain is a close relation to its head than the superior intercostal artery. So the answer here is just the middle tract of the brachial plexus passes posterior to the scalene tubercle. Okay, the next question is concerning the structure that passes via the thoracic inlet, or are all the following pass except dash. So we have A, we have the lungs, B, we have the brachiocephalic veins, C, we have the aorta, D, we have the thoracic duct. So this one passes, this one also passes, and that one also passes, but the aorta doesn't pass through the thoracic inlet. Anterior posterior diameter of the thorax increases by A. Pump handle movement of the ribs, B. Bucket handle movement of ribs, C. Contraction of the diaphragm, D. Relaxation of the diaphragm. So the answer here is just the pump handle movement of the ribs. Concerning the nerves supplied to the lungs, the following is false. A. Parasympathetic supply is provided by the vagal nerves. B. Sympathetic are motor to the brachial muscle. C. Parasympathetic are secretor motor to mucous glands. D. Sensory fibers are responsible for the cough reflex. So the statement which is false in this case is just B, which is sympathetics are motor to the brachial muscle. The following is true with regards to the differences of left and right lungs. The following is true with regards to the difference of left and right lung. So A. Lingula is found on the right lung. B. Right lung has 2 lobes. C. Left lung has 2 fissures. D. Aspirated foreign body will likely be in the right lung, which is correct. So you need to understand that the right lung is normally wide. It's normally wide. So choose the correct statement with regard to the pericardium. A. Ascending aorta is posterior to the transverse pericardial sinus. B. Vena cava are anterior to the transverse pericardial sinus. C. Cul-de-sac for oblique pericardial is posterior to left atrium. D. Serous pericardium forms the boundary for mediastinum. So the correct statement according to the question is just C, which is the cul-de-sac for oblique pericardial sinus is posterior to the left atrium. The base of the heart is mainly likely by A. Right atrium, B. Left ventricle, C. Left atrium, D. Right ventricle. So we need to understand that when you talk of the base, the base is mostly formed by the right and left atrium, but the one which has much proportion is the left atrium. Regarding the conductive system of the heart, the following is true. A. Moderator band contains fibers of the right bundle branch. B. AV node is the only muscular connection between ventricle. C. SA node generates electrical impulse rate of 40 to 60 beats per minute. Most of the conductive system is supplied by the left coronary artery. So the answer here is just A, which is moderator band contain fibers of the right bundle branch. So this statement is the only correct statement here. All the following are branches of the descending thoracic aorta except A. We have 9 posterior intercostal artery, B. Left brachial artery, C. Right brachial artery, D. Superior phrenic artery. So the left, right, and superior phrenic artery are branches of the descending thoracic aorta. They are branches, but the 9 posterior intercostal arteries, they are not branches of this artery. Concerning the basilic vein, which of the following is correct? It continues as the axillary vein. B. Pierces deep fascia in the lower forearm. C. It passes behind the medial epicondyle of the humerus. It is joined by the medial cubital vein in the cubital fossa. So the answer here is just A, which is it continues as the axillary vein. In human, the standard anatomic textbook describes the extent of the pyramidalis muscle to be just 80 to 90. That's the correct answer. True regarding the inguinal or palpate ligament. A. Formed by the lower border of internal oblique aponeurosis. B. Extend from the anterior superior spine of that. Has an extension called lacunar ligament on the lateral end ligaments. So here we are talking about the inguinal region, but this topic is on the part of the pelvic region, and when you're talking about the lower limb, so this is not part of your test 1. So since I'm much focused on test 1, I'm not going to consider this question. So for this one, I'll handle it in the upcoming videos. Morrison pouch is found between which 2 organs? A. Urinary bladder and uterus. B. Liver and right kidney. C. Spleen and left kidney. D. Diaphragm and spleen. So the answer here is just the liver and the right kidney. So this is coming from the digestive system. Which organ makes an impression on the left lobe of the liver? Which organ makes an impression on the left lobe of the liver? So the answer is just the stomach. So the stomach is the one which makes an impression on the left lobe of the liver. The following is true with regard to the major salivary gland. A. Submandibular duct is also called Stenson's duct. B. Bailey's pulse is a possible complication of parotidectomy. C. Submandibular duct is called duct of Bartholin. D. Parotid duct drains into the vestibula near the second lower molar tooth. So the answer here is just simply the Bell's palsy is a possible complication of parotidectomy. According to Kaunaut's functional liver anatomy, the liver has how many segments? A, you have 6, B, you have 8, C, you have 10, D, you have 12. So the answer here is just 8. The callot triangle contains the lymph node of Lad. Which organ, when inflated, is more likely to cause lymphadenopathy of this node? So we have gallbladder, we have liver, we have pancreas, we have duodenum. The answer is just the gallbladder. Concerning pancreatic duct, the following is true. A. Tail of pancreas is drained by the duct of Winsang. B. Duct of Winsang opens at the minor duodenum papilla. C. Duct of Santoris join the common bowel duct. D. Both ducts open in the third part of the. So the answer here is just the tail of pancreas is drained by the duct of Winsang. The following artery is correctly matched to its origin. A. Left colic artery, superior mesenteric artery. B. Superior pancreatico duodenal artery, and then it's linked with gastroduodenal artery. C. Inferior pancreaticodemal artery, inferior mesenteric artery. D. Right gastric artery, colic trunk. So the answer here, which is correctly matched, is just the superior pancreatico duodenal artery, which is a branch from the, or which originate from the gastroduodenal artery. Regarding the difference between jejunum and ileum, A. Ileum has larger precursor circular compared to jejunum. B. Jejunum has sparsely set circular fold than ileum. C. Vasa recta of ileum are numerous and short. D. Vasa recta of jejunum are numerous and long. So the answer here is just C, which is the vasa recta of ileum are numerous and short. Which vein form the hepatic portal vein? A. We have the inferior mesenteric and splenic vein. B. We have splenic vein and superior mesenteric vein. C. We have the renal vein and inferior mesenteric vein. D. We have hepatic vein and superior pancreatico duodenal vein. So the answer here is just B, which is the splenic vein and the superior mesenteric vein. The common bowel duct is formed by A. Cystic duct and right hepatic duct. B. Left and right hepatic duct. C. Common hepatic duct and cystic duct. D. Ampulla of data and main pancreatic duct. So the answer here is just C, which is the common hepatic duct and cystic duct. Fracture of the following ribs may lead to splenic rupture. Fracture of the following ribs may lead to splenic rupture. So A, we have 6, 7, 8. B, we have 7, 8, 9. C, we have 9, 10, 11. D, we have 10, 12, and 11. So if you look at the splenic, it's within the region 9 to 10 ribs. So the answer here is just C. Which structure passes between the body and the uncyanated process of the pancreas? A, we have the colic trunk. B, we have the superior mesenteric artery. C, we have the inferior mesenteric artery. D, we have the hepatic portal vein. So the answer here is just the superior mesenteric artery. From posterior to anterior, the arrangement of the structure of the portal hepatide is A, we have the common hepatic duct, hepatic artery proper, and hepatic portal vein. And then B, we have the hepatic artery proper, and then we have hepatic portal vein, and then we have the common hepatic duct. Then C, we have the hepatic portal vein, hepatic artery proper, common hepatic duct, and D we have hepatic artery, common hepatic duct, and hepatic vein. So here we are looking for the posterior to anterior arrangement of the structures at the portal hepatis. So we are trying to analyze how the arrangement is. So from posterior to the anterior, we need to understand that we have the hepatic portal vein which starts, and then we have the hepatic portal artery, and then the last one is the duct. So the first one has to be the vein, so in this case has to be this guy here, the hepatic portal vein, and then we have the hepatic artery proper, and then we have the common hepatic duct. So that's the arrangement from the posterior to the anterior. Alright guys, thank you very much for joining me. This was Dr. Possibility from Excel Academy. Kindly make sure that you subscribe to our YouTube channel and make sure that you register with Excel Academy by contacting the lines on the screen.